Hello, everyone. Welcome to our International Day of Older Persons event delivered by the Asian Pacific Regional Office of UNFPA. My name is Rintaro Mori. I'm a regional advisor on population aging and sustainable development at the Asia and the Pacific Regional Office of the UNFPA. Today is the 1st of October. The 1st of October is an International Day for Older Persons. In this event, we're actually going to unveil our life cycle approach to population aging and also the launching a new publication called the Social Policy Catalog for the Population Aging. I'm going to explain about the structure of the whole of event. This event is going to last 1.5 hours, starting from the opening remarks by our regional director, Mr. Bjorn Andersson, followed by the brief video clip explaining the life cycle approach. Then the main part of this session on this event is a moderated conversation. Moderated conversation of the experts in this region. Then we're going to have the closing remarks by the Mrs. Eva. So and also probably you are actually all the audience. You are probably listening to this event via Facebook and YouTube. And any questions and the comments and the feedback are welcome. So anytime during the event. So please put your comments and the questions and the feedback in the platform you're actually listening to. And we will convey this message and the comments and the questions to the panelists. So we might not be able to answer all the questions, but we will listen to you. And just to let you know also that in this event, there is a simultaneous interpretation with the Japanese as well. So if you really want to listen to this event in Japanese, you can choose a different link, the YouTube link, sort of the dedicated YouTube link to listen to the Japanese. So I'm going to start this event. So firstly, we're going to have the opening remarks by our regional director, Mr. Bjorn Andersson. So over to you, Bjorn. You're muted.
So thank you, Rintaro, for that, reminding me to unmute. Now, I hope everyone can hear me. So good morning and good afternoon and good evening, everyone. And welcome to UNFPA's special event to commemorate the International Day of Older Persons, which is the first of a series of discussions we plan at UNFPA to have on population aging. And today we are going to focus on a life cycle approach and intergenerational solidarity as key solutions to some of the challenges related to population aging. As many of us know, the Asia-Pacific region has some of the most rapidly aging populations in the world and is home to half of the world's older persons, defined as those above 60 years of age. Countries like China, Japan, and the Republic of Korea are at the forefront of this demographic shift, which has enormous socioeconomic implications. But even countries where young people currently constitute the majority, like India and Indonesia, will be transformed in the not too distant future. Population aging is often brought on by individuals living longer thanks to socioeconomic advances, including greater access to healthcare and increases in the share of older persons in the total population. This phenomenon is further fueled by a lower fertility rate, such as in countries like Japan, Singapore, and the Republic of Korea. Population aging, without a doubt, is an achievement of sustainable development, and older persons have much to contribute. In many countries in the Asia and the Pacific region, older persons are responsible for looking after grandchildren and tend to have more time to volunteer and contribute to local communities than those who are economically active. In many countries, especially across Asia Pacific, it is older persons who are local leaders, like some of our panelists at our event today, who have the expertise, experience, local knowledge, and respect to help with conflict resolution in communities and key responses during emergencies. But far too often, older persons are left behind, with women bearing the brunt. Women constitute the majority of the oldest old, those above 80 years of age, and due to men's greater lifetime earnings in most countries, there is an increasing feminization of poverty among older women. The challenges that older persons face in Asia and the Pacific have been driven home all the more amid the ongoing COVID pandemic. As a custodian of the landmark program of action that stemmed from the 1994 International Conference on Population and Development, or ICPD, with its vision of rights and choices for all, UNFPA is increasingly being called upon by governments and civil society partners to help strategize and support policies to address population aging in Asia Pacific and globally. It is with that in mind that UNFPA, through our Asia Pacific Regional Office, has developed a social policies catalog on population aging, which seeks to systematically identify and collate available social policies on population aging on a global scale. Through the course of developing the social policies catalog, we learned that no country has a single comprehensive policy that addresses all aspects of the dynamic population transition of aging in the Asia-Pacific region. For example, many policies in the region that address population aging do not include intergenerational engagement, while others lack sufficient social inclusion components which would enable the full and meaningful participation of older persons in society. This compilation or rapid scoping review, which we are launching today, is all the more timely as the world grapples with the COVID-19 crisis and seeks to regain lost ground in achieving the 2030 Agenda and its Sustainable Development Goals with the promise of leaving no one behind. And it is our hope that this catalog will enable governments to learn from and improve on existing policies, to further our efforts on successful aging and shape strategies for the region. The catalog also provides an important opportunity for governments to learn from each other in the spirit of South-South cooperation and triangular cooperation. So, ladies and gentlemen, as we commemorate this International Day of Older Persons, let us recommit to ensuring that our policy responses fully reflect the needs of older persons and promote healthy aging. A life cycle approach with gender equality and social inclusion at its core can support all generations so as to address fundamental societal and human rights issues revealed by rapid population aging and extreme fertility decline. This will require that we strengthen health systems, including through universal health coverage, to promote healthy lifestyles throughout the life course to reduce risks of non-communicable diseases. Ensure equal access to sexual and reproductive health and rights to enable lifelong choices of pregnancy, childbirth, and childbearing based on the right of all couples and individuals to decide freely and responsibly the number, spacing, and timing of their children. Strengthen social policies, including social protection, to ensure that all individuals in society can attain an education and decent work and have access to social safety nets such as childcare and pension schemes to reduce the concentration of poverty in older populations. And finally, eliminate discrimination against older persons or ageism through the promotion of social inclusion, including intergenerational solidarity and age-friendly environments to transform the society positive towards aging. So, ladies and gentlemen, before I conclude, I would like to thank all of you for joining us today, including media partners who are so essential in educating the wider public about an issue that impacts us all in so many different ways. I hope that today's conversation and those that follow, along with UNFPA's work at country and regional level going forward, will lead efforts to address the population aging to a new level of achievement. I thank you.
Thank you very much, Björn, for this opening remarks. So we're going to show you the short video explaining the life cycle approach that Björn was mentioning. Okay.
In recent decades, we have seen major improvements in nutrition, education, healthcare, and sanitation worldwide. As a result, we are living longer than ever before. This social transformation is a triumph of development. Asia and the Pacific is a diverse region, and how people age is often dependent on factors such as wealth, ethnicity, social standing, and education. The effects of gender discrimination throughout life, including fewer rights, less access to education and health services, as well as lower earning capacity, leave women even more disadvantaged in an aging society. To ensure that progress is inclusive for all and to take advantage of the opportunities an aging population offers, governments must incorporate aging issues into national development and health plans. Otherwise, an aging population places an unsustainable strain on financial and healthcare systems. If policies address the whole life cycle, healthy older people can contribute financially by working and socially by volunteering and caring for family members. A life cycle approach to aging offers an opportunity to benefit all in society. This means making investments and formulating legislation in terms of income security, healthcare and pensions across the life cycle, and considering all life's milestones from birth through to childhood, education, working years and beyond. Prenatal care reduces infant and maternal mortality and promotes longer-term health. CSE, or Comprehensive Sexuality Education, helps prevent unintended pregnancy and STIs and gives girls control of reproductive health. Elimination of harmful practices prevents forced or early marriage and allows girls to reach their potential. Intergenerational relationships allow flexibility as different generations play a part in family life. Promote social inclusion to meet the health needs of older people and include them in decision-making. Tackling ageism helps fight discrimination and social prejudice. This life cycle approach needs to be ongoing and ingrained in society through the development of sustainable and equitable systems of health and social care, backed by data measurement and research. Let's look at the milestones facing two women born on the same day in Asia Pacific. A is from a poor rural family in a low-income country, and B is born to a professional urban family in an upper middle-income country. Both girls have the same potential, but are on very different life paths. B's birth in a hospital is safe. Her mother had a midwife who supports her with advice on breastfeeding and childhood nutrition. Born at home in her village, A has no access to maternity services. Mothers and children like her are vulnerable to complications during pregnancy, childbirth, and the postnatal period. Support from public health services, health checks, and full vaccinations help B grow into a healthy toddler. Children in low-income countries like A's are likely to have low birth weight and to be malnourished. Disadvantaged nutritional and social environments put children at increased risk of chronic conditions in later life. This is costly for individuals and society. In upper middle income nations, pre-primary education is widespread, so B gets a head start in learning and social interaction. In low-income nations, many children will receive basic primary education. Girls, marginalized populations, and displaced people often fall behind. Primary education levels have a huge impact on social, political, cultural, and economic conditions in a country. As a teenager, B has lessons in building better gender relationships and on reproductive health. The skills she learns will help her build lifelong relationships and avoid loneliness along the life cycle. In A's culture, girls marry young. With no access to education on sex and contraception, she cannot easily plan her family. When she becomes pregnant, she leaves school and is at greater risk of poverty, isolation, and domestic violence. Early pregnancy affects girls' health, education, and future financial potential. In upper-income nations, the average marriage age is older, so B has time and flexibility to make decisions on education and when to start a family or pursue a career. In all nations, especially in disadvantaged environments, sedentary lifestyles, increased consumption of sugars and fast food, as well as smoking, drug and alcohol use, escalates instances of conditions like hypertension, as well as cancer and diabetes. The life cycle approach must analyze changes in lifestyle and encourage lifelong exercise to reduce risk factors. While her husband goes overseas to work, A sells goods in a local market to support her family. This is low-paid and insecure work. B has access to childcare benefits and pension savings so she can plan for a future for their children. Reproductive health services help with family planning and fertility so she can plan pregnancies around her career. With no such access to family planning services, A soon has a second child. The birth leaves her with a fistula. Without universal health coverage or money to treat her problem, she suffers from incontinence, social stigma, and has fewer work opportunities as she heads into old age. B and her partner can save money from their jobs and have pensions. Lifelong universal health coverage and social benefits for the elderly reduces the burden of care for families. Now a widow at 60, A has moved in with her adult son. She worries about contributing to the household. Her small government pension does not cover the costs of medicine and food. Age-friendly policies and infrastructure allow B to enjoy an active lifestyle. At 70, she is able to work, volunteer, study and be independent, while having time to spend with her family. A suffers mobility issues. She spends long hours at home, caring for her grandchildren, a role she loves, but which she finds harder to fulfill as her health deteriorates. She is increasingly isolated and worried about the burden on her now grown children. The disparities in the lives of A and B are unfair but not inevitable. If more governments in the Asia-Pacific region emphasize a lifestyle approach to aging alongside economic development, millions of people could have improved life chances and a better likelihood of a happy older age. Early life intervention, universal health coverage, and an education that reduces harmful practices can be standard in all nations in the Asia-Pacific region. This life cycle approach requires changes in laws and attitudes to social protection, gender equality, universal health coverage, and how older people are treated. This is already happening. The Republic of Korea has passed an act of anti-discrimination and employment of older persons. In China, pensions reforms have incentivized workforce formalization and have increased coverage of social security systems. Japan promotes healthy aging with policies starting from pregnancy and childbirth through the whole life course. Its integrated system is based on long-term care insurance, the promotion of intergenerational solidarity, and the sustainability of an aging society. Policies such as these will help nations benefit from the ongoing demographic changes in Asia-Pacific, leading to wealthier, happier societies that benefit all generations.
Now, you might have a sort of a better idea on what this life cycle approach means. So based on that life cycle approach, as well as intergenerational solidarity, when you think about population aging and how we address that, I think we're going to have a moderated conversation, which is moderated by Professor Stuart Giteau-Baston. He's a professor in social science and public policy at the Hong Kong University of Science and Technology. So over to you, Stuart.
Well, thank you very much, Rintaro. And firstly, may I wish you all a very happy International Day for Older Persons. May I also say Zong Tao Sing Fai Lok, which in my terrible Cantonese is very happy Mid-Autumn Festival. I know that a lot of friends and colleagues around the world will be celebrating that today. So we thank you for taking a break in your festivities and mooncake eating to be with us this afternoon. Also, for our friends in Sri Lanka, I wish you a very happy Children's Day. I think it's amazing that in Sri Lanka, in that incredible island, both younger persons and older persons are celebrated on the same day. Poor middle-aged people like me don't have anything special, but it seems entirely appropriate for the theme of our discussion today, which is successfully addressing rapid population aging in Asia Pacific, a life cycle approach with gender equality and social inclusion at the centre. So as Rintaro said, my name is Sukhito Bastin, and I'm a professor here at the Hong Kong University of Science and Technology and the director of our Centre for Aging Science. And it really is my true privilege to moderate this session this afternoon. Now, of course, while we have much to celebrate today, we are also in the midst of a devastating international pandemic, which is exposing deep vulnerabilities and disproportionately affecting many different population groups in the most brutal ways. So I think before we begin our discussion, I might ask our UNFPA colleagues to show a very short 1-minute video which offers some voices from older persons around the region in order to recognise some of these challenges.
Title the video.
Well, perhaps it looks like this video is not forthcoming, so maybe we will come back to that a little bit later on. So anyway, let's kick off, and if I may just quickly introduce our panelists this afternoon. So we're delighted to be joined by Krishna and Gautam, who is the chairperson of Aging Nepal. Their advocacy in Nepal has empowered older persons and led to population aging issues being incorporated ever more strongly into the national development agenda. And also, I'd particularly like to congratulate the organisation and Krishna in particular for recently being awarded the UNESCO Literacy Prize this year. So many congratulations. Next is Professor Dr. Tunku Ihsan Hamid, who is the Professor in Gerontology and Social Policy, the Malaysian Research Institute on My Aging, now My Aging, at the University Putra Malaysia. Professor Dr. Hamid is a key contributor to policy development on population aging in Malaysia and works in collaboration with a range of partners across the region. Next, we are delighted to welcome Ryosuke Kanamori, who works with the Dementia Supporter Caravan in Japan. This initiative involves well over 1 million people, including young persons who are learning how to support older persons, including those with dementia, as part of an international approach to population aging. And Kanamori-san will present in Japanese. However, we will have a simultaneous translation after a few moments delay. So our final panelist is Argentina Mataval, who is the UNFPA representative for India and country director for Bhutan, and also has extensive experience from elsewhere in the region, having been UNFPA representative in Bangladesh and Mongolia. And finally, the closing remarks will be provided by Eva Sabdono, who is the director of Yayasan Emong Lansia, apologies for my terrible Bahasa, in Indonesia, which is a member of the Help Age Global Network. I have just been told that the video is ready to go, so I pass over to very quickly to UNFPA to show that video.
दवाइयाँ मौके पे नहीं मिलती.
میرفتیم جلسه میرفتیم و میرفتیم بچه نماز میخوندیم الان 2 ماه تو خانه نشستیم
มันไม่มีเงินที่เราเก็บไว้มันก็หมดไป
지갑 같은 데 가서 내 취미 생활을 해야 되는데 내 취미 생활을 못하고 그냥 집에 어디 나가지 마 노인네들 나가지 말라고 그러니까 집에서만 그냥 묶여 있습니다. 그래서 참 답답합니다.
मजदूरी करते हैं, काम करते हैं, नौकरी करते हैं. कोरोना और लॉकडाउन की वजह से इनके कारोबार खत्म हो गए हैं, इनका रोजगार खत्म हो गया है.
ใช่ไหมเราเป็นหนี้เขาอะทุกครั้งไม่เคยเป็นหนี้ถ้ามาเป็นหนี้เพราะอันเนี้ย
اینه که بیکار شدیم نمیدونم میترسیم از کرونا بگیریم سنمون بالاست دارو نیست
ผมว่าโอ้ป้าอยากได้ไว้เยอะโอ้โหนายยังหวังอยู่ยังหวัง
Thank you very much. And again, our thoughts are with all of those people around the region who are struggling with the various aspects of this current situation. So, and I'm sure we'll return to the issue later on in our discussion. But in the meantime, let's just stay on the theme, begin with the theme of the meeting today. And let me just first ask each panelist to introduce their organizations a little bit more, and perhaps if they could talk a little about the ways in which this life cycle approach to population aging with gender equality and social inclusion at the center could be a reality in their country. Perhaps I might ask Krishna if you might kick off. Oh, can you unmute? Sorry.
Thank you, Professor, and greetings to all. I'm happy to be here and share some of my thoughts or some of our work that we have been doing. Firstly, what I realized in Aging Nepal, we realized that lack of disintegrated data on aging population is the main problem. There is not enough research, and there is not enough funding coming from any resource also. So we gathered some fund, and we're trying to provide a scholarship to the master level students to do their master thesis, so that they also get some income, and we get a trained, a knowledgeable human being plus a thesis plus the data. So that has been a very successful program. And second program we did is about the life cycle approach. One of the important thing is enabling the environment for them. And most unenabling situation is the illiteracy. It's both basic illiteracy and digital illiteracy. That is killing all the feelings and ability of our older people. They are knowledgeable, but how can they express this in today's society because they are illiterate? And how can we, those others who are not old, can make benefit of it, because they cannot express themselves. They cannot use the technology. We will not be able to be participant today if we are illiterate, both basically and digitally. So literacy is important. And for that, we have been running literacy program for 60+ people. They learn differently. Their mind operates differently. Their cognitive capacity is different. So there's different types of books and different training methods, teaching methods to understand or grasp what is being taught. And there is some technology or some innovation we did, for which we have been awarded the UNESCO International Prize, and we take very pride of it. And second thing we focus on is our unmet, we have been encouraging our youth to health unmet care and health needs of older people. There are not enough trained geriatric nurses. There are not enough trained caregiver in Nepal. So those are the two types of program we run, and trying to convince the government to take it to a larger scale, because Aging Nepal as a small NGO can do very little thing. And one of the important thing I would like to mention to this very important group today is older people are not all poor. Let me take an example from my country. Nepal has remained an agrarian economy for long, which means a majority of older people of today are the landowners, the market value of which is soaring high due to rapid urbanization. A poor farmer of yesterday suddenly turns into a millionaire. A recent survey of cooperatives in Nepal revealed that more than 60% of their fixed deposit comes from today's older adults. But the question is, are we thinking of channelizing this financial resource of older adults for our industrialization and societal development? So that is the one of the policy development we are pushing through the government and reaching nowhere so far. And it is our pride that we are successful in adding the average life expectancy of people. But the question is, what are we doing with the added life? Are we putting this life into the production system of the country, of the society? And that is, again, a difficult thing to put in the government policies and program. If they put, they have nice word to put it, but at the implementation level, the mobilization of it or the use of this added life expectancy has been one of the problems. So I highlighted the need for education, need for training youth, and mobilizing the resource for the older people. It's not, I'm not asking the government resource, but the resource of the older people themselves. And then we believe that access to education is one of the basic human rights. Any justification to deny that right to the aging population would be the ageism in practice, which is a social evil that we all stand against. We do, however, realize that there are unmet educational needs of other age groups that have higher potential for a greater return to the society. Given that reality, we argue for a proportionate share of resource allocation for lifelong learning. Advancement in technology have made our day-to-day life faster, easier, efficient, and more productive. Denying access to basic and digital literacy to older adults also means denying them to benefits of technological innovations and leaving them to suffer dependency, isolation, abuse, and ill health. The youth of today will also need an education system that will enable them to benefit from future technology, which we don't know how, in what form, and what buttons that it will come with. Finally, I appeal to provide a due share of priority to the lifelong learning, education, 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 to the ever-growing aging population of today and tomorrow. I think only this will enable us to ensure a better old age for all of us and for our children. And that is the life cycle approach begins with education. Thank you.
Thank you so much, Mr. Gautam. That's a very powerful message there. And that particularly lifelong learning is an absolute fundamental part of this intergenerational approach. Professor Hamid, maybe I could just ask you about your thoughts on this life cycle approach and particularly with gender equality in Malaysia, for example.
Okay, let me start it this way. When I was attached to the Department of Human Development and Family Studies, we teach students from birth to death, and I'm the death part, the tomb part of the curriculum. Yeah. So in the sense that when we teach the human ecology program, we already taught the students about the lifespan perspective of aging, of the whole lifespan and aging, and the different interventions that we have to go through so that we can plan for a healthy family and things like that. So in that perspective, then we started this program, this human ecology program in 1970s, very early on in life. So in that sense, then the lifespans approach was already incorporated in our curriculum for that, because we were adopting the human ecology perspective of development in the human life. And when you talk about gender inequality in terms of lifespan perspective, in Malaysia, there are actually disadvantages along the way for women, because we are still culturally attached to female, the gender roles and very specific gender roles for certain things. So, for example, like even now in modern Malaysia, educated women opt out not to teach and not to go into employment because there are what you call issues regarding childcare and things like that. That they felt that it's more economical for them to stay out of the labor force rather than to put their children into a day center or a childcare center that's not really very good. So in that perspective, then you would have in the long run, you would have women who will not have enough money as a social protection in old age. And we know that in Malaysia and in all over the world, the discrepancy in terms of longevity is there presently. So in that sense, then we need to really look at the social protection element in terms of the life cost perspective on providing for women, because we have an advantage of our longevity, but at the same time we are not really, our labor force participation is actually interrupted across the lifespan, and we cannot easily go back into the formal labor force unless and very few opportunities are available. So I'll stop there first.
Well, thank you very much, Professor Hamid. Now, I wonder whether, and you mentioned very important these issues of social policy there and that interaction between social policy and gender equality. And I'll come back to that in a moment, if I may. I just want to, if I could just bring in Kanamori-san here, who may be able to talk to us with a very concrete example of the intergenerational activities of his organization, and how social inclusion really is a key part of that. If Kanamori-san, could you tell us a little bit about the activities of the Dementia Caravan, supporter Caravan?
はい、はじめまして。認知症サポーターキャラバンの一員として参加させていただいています、金森亮介と申します。僕たちは認知症になってからも自分らしく暮らせる社会というものの実現のために
live as they are in the society even after the onset of dementia. We have developed a training course. So these dementia supporters training is a series of lectures to gain more understanding about the condition dementia. So this is the picture of the session. So these people are certified as dementia supporters. And at our university, we invite these supporters so that they can have exchange with students. So what is the dementia like? What is the dementia all about? In this way, lecture is given, and there is an exchange among students and supporters. So these dementia supporters don't have any particular obligations or duties. They understand dementia well, and they support the dementia people as well as their family members. So by developing such supporters, so that people can live with peace of mind in the community. So that's all. Thank you.
Thank you very much. Well, it's amazing for the first time in my entire life to have a simultaneous translation via Zoom. It's absolutely remarkable how things have changed. Thank you so much, Kanamori-san. Maybe could I turn to Miss Matavel, Argentina, if I may. Perhaps could you talk a little bit about some of the challenges that you would anticipate in, or possibilities you would anticipate in India and Bhutan for that matter, with regard to implementing this notion of a life cycle approach to population aging, particularly with relation to gender equality?
Thank you, Professor, and thank you to all the previous speakers for raising very important issues. India is a very interesting country demographically because we have on the one hand a very large youthful population, and I'm talking just between 10 and 24, 365 million, and older than 60, already 104 million. And those two groups will continue to grow in terms of proportion for a few years to come in parallel. And so that poses both a challenge and an opportunity in the country, in the sense that a challenge because governments are overwhelmed with the sheer size of the younger population that has very pressing needs of education, health, and other needs, and because they're so visible. But at the same time, knowing at the background that they have a clock that is ticking with this large number of older population, which by 2041 will already, be more than close to 250 million. And so what could be done, but it's not actually being done. But on the one hand, you have the culture in India, which promotes, because of its spiritual view of life, a life cycle approach of looking at life, where people are always aware that, there's a birth, growth, and death is always present, and then a rebirth. However, then you have the actual system, which should be promoting a lifestyle in a more deliberate way. I'm talking more about the education system, for example. And that is not necessarily happening. And so there could be a lot of gains in promoting, as many people have spoken about. And the question, as you rightly point out, is the challenges. And I started talking about some of those. And you have a vast number of jobless young people, which could be linked even just, to the older generation in terms of helping to address some of the challenges that older people could have, but also to link the old people's knowledge and, their repository of so much experience to pass on that knowledge to the younger people. When you look at issues of gender, what we notice is that because of the many challenges with the societal structure of caste, tribals, religion, you have everything. It's a melting pot in India. And you have a lot of the women working for with unpaid, for unpaid jobs. And so when they get later in life to old age, it's their husbands or male members who have worked and deducted for taxes who have pensions. And the statistics showing that, women are living longer than men. So they end up also not benefiting from the pension that the man has managed to accumulate. And so maybe I'll, for now, stop there to say that, the challenges are mainly the pressure of the younger that are very visible over the old. And then in India, you have the north, which is very young, and the south already getting gray. And so the challenges are slightly different from where you are, where you sit in India. Thank you, Professor.
Thank you very much. Thank you very much, Argentina, if I may. Well, just to go back a little bit, Professor Hamid talked a little bit about social policies. And of course, today UNFPA has presented a catalogue of social policies relating to ageing. And I would like to ask the panelists which areas of social policy beyond, as we've already discussed, they would like to see prioritised in their countries or communities, because of course there's a danger that we have a one-size-fits-all, but there'll be particular needs and directions for different places. Now, of course, work is a key part of social policy systems. So before I turn to the panel, I'd just like to ask our UNFPA colleagues if they could quickly show a very short 1-minute video on the issue of work and so-called retirement in speech mark in Nepal. If they could just show that quickly.
छोराखेत बसेर काम गरिरहेको छु म होइन अवकाश भएको जागिरबाट अनि त्यो घरमा बस्नुभन्दा त केही आफ्नो स्वास्थ्यको लागि केहीको लागि काम गर्नु पर्यो
वर्षको काम गरेको 22 सालदेखि
उतामा मैले 58 वर्षमा
ठेगान छैन त्यो त ठेगानै हुँदैन जबसम्म हातखुट्टा चल्छ तबसम्म गर्ने
सकिन्छ होइन म काम गर्छु भनेर काम गरिरहेको छु अझै पनि केही नयाँ कुरो सिक्यो भने अझै पनि गर्छु त्यति हिम्मत छ मलाई कसै छैन अब परिवार खेर बसिरहेको छ नातिहरूलाई हेर्दैछु आफ्नो काम पनि गरिरहेको छु छोरालाई पनि सहयोग भइरहेछ
यसैमा है अर्को के गर्नु
खुसी हुनुहुन्छ यसबाट
यसैबाट खुसी
Is it time to rethink how we define work? Is it time to rethink how we define older persons in the labor force?
Thank you very much. Krishna, could you maybe just tell us a little bit more about that video and then how it would lead into some of the kind of social policy developments that you would like to see in Nepal to actually make those kind of things happen? Oh, you're muted. Sorry.
It's not we have to make it. As far as I understand, in countries like Bangladesh, India, and Nepal, people do continue work after they are officially retired, and there are very more people employed in the informal sector. So they don't have this pension and the financial security given by this formal sector employee. So they have to depend on their own. Because of poverty also, there are many older people below the poverty line. So it is compulsory for them to work, and they are working. So social pension and social support, yes, that's required. But what's required is social doors to open for the older people to participate and show their strength, how they can contribute. And we devise a different system where this informal sector, their contribution of older people is counted in the national economy. You know, a grandmother works 9 hours a day to support grandchildren in the family, but her labor is not counted. She's just old lady doing nothing. No, but actually she is supporting the family in indirect way without the income. So this informal sector run by the many older people, and our formal economy failing to count that economy in the formal sector, that is one of the problems. And another thing what I see is we have running in this process of development program or country development program, for example, implementing agriculture development programs, implementing forestry development programs, implementing livestock development programs. You know, this is what is needed in our country. But in those programs, where is the room where older people can be formally involved? And that doors are closed. So they are pushed out in the informal sector, and their contribution is not counted. That's very unfair. So if we keep our older people out of the production system, we push them out of any production system and do not count their labor or their contribution to the economy, you know, in the informal sector. And it doesn't matter how much social security we call it is social security is not only supporting them, but even counting or recognizing the support they are giving to the society. So I think that's what we are feeling. Thank you. Thank you, Professor.
Ms. Matawal, I wonder if you could maybe tell us a little bit about precisely those challenges of developing and implementing social policy in somewhere like India, where, of course, the informal sector is a predominant mode within the labour force. You're muted. Sorry.
We currently have about 7 policies, schemes, programs supposedly directed for the benefit of the elderly. However, one of the biggest challenges is actually the coordination of the implementation of those schemes, because they are spread among 19 ministries on our last count. So, and the ministry that is supposed to lead is not always the one that has the most clout in terms of ability to call the others and coordinate. We all know that in government, some ministries are more powerful than others. And so we need a bit more coordination. We need a more integrated service model that would roll out for both rural and urban, because we notice that the most destitute elderly are in rural areas, because those are the ones that did most unpaid work and continue to work even to their well advanced ages, even after 70, caring for the young. And so that a vision for elderly people in India is needed, with a very clear set of bold actions. We have a lot of examples. We have the Madrid Action Plan that gives very concrete examples of what could be done for the elderly. It's not a lack of recipe of a menu of what needs to be done. It's the coordination of the system that is most challenging in India, but also a more tailored policy that looks into issues of differentiated issues to target marginalize all the people, like, scheduled tribes, scheduled castes, widows, people with disability, people living alone, the oldest of the older, the homeless, the destitute, and we have it all. So for a moment, I think I'll stop there, and thank you.
Thank you very much. Professor Hamid, I wonder if you might tell us a little bit about the social policy configurations in Malaysia, because I know in some ways it's quite centralized in terms of the Provident Fund and so on, but then also decentralized. So could you just tell us a little bit about what works in Malaysia and what improvements in social policy you would like to see?
Okay, let me talk about. I want to pick up on Argentina's work in terms of collaboration and in terms of coordination, because we are a federated states, and we have the state, so we are federal and state government kind of level. And when you talk about the aging policy itself, our biggest challenge to me is collaboration between agencies, because we do have the hierarchy of ministry as Argentina mentioned, and these are issues for us to handle, because I think for us, we have the policy on the elderly, which already adopted the principles of the Madrid, and also the active aging and productive aging framework of Madrid, and also the WHO perspective. So, and also we're taking the lifespan perspective in that policy. But to me, the main concern for us is the trickle down of the policy into the implementation level, because to me, there is a gap in terms of translating this and understanding what's in the policy to the people on the ground. So that's why there is gaps in implementation. So I think the most important thing to us is that we already have at the national level the coordinating committees for these policies. We have, I think, 7 subcommittees on that. but we don't really have, let's say, an annual report of the implementation of the policy, so that for us to monitor and to review the implementation issue in terms of that. But because we have in the, well, they call it in Malaysia the Council for Policies on Older Person, and we have for health, it is headed by the Health Ministry. For the focus on education, it is headed by the Ministry of Education and things like that. But the understanding to me of how it can translate into the local agenda and implementation at the local level is what is the weakness that we are facing in Malaysia. Because, and also to me, the aging agenda has not really been the key initiator for this kind of policies that is implemented. Though we have about maybe 60%, if I'm right in terms of this, in the informal sector. So when you talk about how do we implement social protection policies, if we do not have the system to collect and to distribute this will be an issue. And recently, the government under the Deputy Prime Minister previously, the First Lady Deputy Prime Minister, we created through EPF a system to cater for older women in terms of saving for their old age through the EPF system, where the government matched sort of 60 ringgit a year contribution of the women in the EPF scheme. But what's good about this scheme is that the benefit of this new what we call it ISURI of this plan is that the women would also get the same benefit as the other members of EPF. So if the EPF return is 6% for that year, they will also get 6%. But since she is not in office anymore, I'm not sure whether that program will be continued. But it is a very good program in terms of looking after the older women, so that they can have something in their old age. Okay, so, I'll stop from here.
Thank you very much, Professor Hamid. Well, I tell you, it's a very dangerous thing to have someone from Malaysia and someone from Hong Kong getting started talking about provident funds, because then we'll be talking all day about provident funds. But I think, let me just move on, and if I may just bring in Eva Sabdona, perhaps to talk about, again, some of those kind of successes and challenges of pensions, social pensions and social security in Indonesia. Eva.
Thank you, Stuart, for the opportunity. I think in Indonesia, it doesn't differ much as in Nepal. In Indonesia, most of the elderly work in the informal sector, about 80%, but they don't have the social protection or the social security in old age. I have been advocating to the policymakers for social security in old age for many years, but until now I'm still waiting for their positive response. It has been discussed many times, but there is no final decision yet. So we are in the same situation as I think in most of the ASEAN countries or in Asia Pacific. Thank you.
Okay, thank you very much. I wonder if, because I'm getting a lot of questions coming in, and I think, to be honest, the questions from the audience are actually much more interesting than the questions that I've prepared. So I think I'm going to start to move over to them and ask around the group, if that's okay. So one kind of group of questions which is coming on. By the way, please put any questions you have on the Facebook streaming page and on YouTube, and they're communicated to me. Well, one question is a little provocative and says that this notion of life cycle aging is nothing new. And whether it's life, and we can't even get it right between agencies, whether we say life cycle aging or life course aging. We've been talking about life cycle and life course since Madrid. We've been talking about this for a very long time. So why hasn't it worked so far, and why should it work today, and what do we need to do to make it work? You see, these questions are a bit more provocative than mine. Maybe I might ask Krishna, if I may, just what are your thoughts on this? Why haven't we got it right so far? Why do we need to say all this again?
No, because I think it's because we don't know how to implement those things. We're talking of the overall theory of it, overall view from the sky, but we are not looking at the down, at the operational level. For example, it's a general question I put many times. I ask myself, in my country, I have seen development program directed to children, development program or directed to women, children, this development program for this group or that group. Why we don't have development programs for the older people? Because if we had that, then maybe we could have developed the process of involving them and making them productive in the system. Then the life cycle approach is the result. It will be in practice. But because we are not thinking in the development terms, so those detailed working operations are not developed, so it doesn't work. So first thing required, I think, is to develop those details. Second question I ask myself is, we all have heard about children's literature, youth literature, women's literature. Why we don't have older people's literature or elderly literature, at least not in my country and in many other countries? And literature does not do, it's not only for fun. It changes the attitude, it changes the mindset. And why we are not talking about literature or elderly literature? So these are few things. We are not talking about the ground rules and steps and small nitty-gritty things to run the vehicle. We are not talking about tires. We are not talking about brakes. We are not talking about fuel injecting machine. And we are just talking about the vehicle should move fast. It will not, until and unless we talk about those parts. Thank you. I hope but that's my understanding of the issue. Thank you, sir.
Thank you. Thank you. Kanamori-san, so, Krishna there is talking about the need to be at the ground level, right? And you're on the ground level, right? You're doing this fantastic work in Japan with different generations, working on dementia, which of course is one of the great challenges of the 21st century. So how are you making it work? And what would you like to do over the next few years, and what support would you need to get there, to kind of really push your organization forward?
Well,
under the current world, each and everyone is working separately, individual. Youth are gathering with youth, and they're doing what they want to do as youth. Middle-aged persons are pursuing their own careers and jobs on their own, and the aged people are living alone or working on their hobbies alone. And in such situation, population is aging, and the aged populations are isolated, and they are prejudiced as if they are all dementia patients. And that's the world that we live in. And that's the world which we face this moment. Under such circumstances, we have to look at the community, regional community. We have to engage from children to adults and older people. In the same region, we have to work as a group unified group, and that's the unified society that we'd like to build. So from the children to middle year people, if everyone is aware of the people with dementia, they will all have to monitor and watch over each other. Dementia may be a part of the illness, but everybody is at risk of being dementia. And then everyone has to have good access. So you will help such people so that you will receive help in the future. And that's the society which we build. I'm not sure my answer is enough, but that's my feeling at this point in time. So that's my desire.
Thank you so much. Ms. Matable, I'm going to ask you a difficult, mean question, because you're the face of the UNFPA in this panel. So why are we still doing this? Why have we got to restate this in 2020? Why has UNFPA not got this sorted out so far? What went wrong? How are we going to make this life cycle approach with gender equality and social inclusion at the heart of it? How are we going to make it work? Why is it going to be different this time? Sorry.
Thank you, Professor, for the $1 million question. Well, UNFPA comes in support of governments, and one of our biggest mandates is really to help governments get policies right. And in some instances, with some Hello, am I back on? Hello?
Yes, you are. I hope you weren't being...
Our internet went off. I was just saying that it's probably on purpose, because I probably don't have the right answer. But I would say that UNFPA's role, having been really to help governments and raise awareness in terms of both awareness on the issues, but also helping them set up the policies, because we come in with very limited resources to actually do and implement things on the ground. And our focus has been mainly the sexual and reproductive health and the young people. And on the aging, I must say, we have concentrated more on helping to set up policies. And why haven't we done it right? When I say we, I mean the people, the governments. I mean, instead of concentrating on why we haven't, what can be done now is that we have a unique opportunity with massification of education. Governments can incorporate in the education system certain lessons of life-changing, of healthy lifestyles, for example, that would lead to healthy aging. In the public health sector, there haven't been enough emphasis on healthy lifestyles. WHO is talking increasingly about non-communicable diseases and an explosion of those kinds of illnesses. And it's all on the hands of public health. So not enough public health communication has gone focusing on healthy lifestyles, and it could be done today. A combination of and then with the technology, with the advent of technology, many people have either a smartphone or a television. The penetration is high in Asia of those devices. So there is a unique opportunity here that I think we can advocate to governments to take on. Thank you.
Thank you very much. I'm sorry, I won't have any more mean questions about UNFPA. Another question. Oh, yes, Professor Hamid. Professor, yeah.
I think I want to add to what Argentina mentioned, because I think we can do it now, because from the experience of the COVID, yeah, that the governments has to work together, all the agencies has to work together, and we do it so that we want to solve a problem. So if we think of aging in that perspective, then it automatically has to change the structure of the way we work. Previously, we are so very territorial and we work in silos, but it will not have. It doesn't work when you want to face a crisis like COVID. So I think if we think about aging as a lifelong process, and we're going towards healthy aging. The way that we need to work is to collaborate with each other, inter-agency and intra-agency, because because we can see this in the example of how we handle COVID. You see, so that probably has hope for the future, that we cannot work in silos to look at development, and sometimes we forget that we want to meet the KPIs of our ministries, each individual ministries, and we forget the human factor that we're working for. You know, so I think if this experience with COVID for the last few months has shown that we can really work together to solve an issue if we understand what we need to do together. So I think there is a possibility, as Argentina says, that we need to really look at it from that perspective, because I'm sure all the government agencies are aware of the lifespan perspective from womb to tomb in terms of social protection and also in terms of education, because right now from education perspective, we already have the formal and informal entries of older people, of matured people into the formal education system, and recognizing the prior experience as a qualification for education. So I think slowly we are going there. Thank you.
Thanks. I mean, I just, and another question which is related to this is that which has come up on Facebook, I think, which is that we often run the risk of talking about older persons as they, that we are developing policies for them. Whereas, of course, a more critical approach would be, and this is embedded in the Madrid Action Plan, is that older persons themselves are fundamentally incorporated in the planning process. Now, has this happened over the since Madrid? Have we got any closer to that? Maybe I might ask Eva Sabdono in Indonesia. In Indonesia, are older persons really incorporated into the policy planning process, such as your organisation is very influential in Indonesia? But to what degree are you actually engaged in shaping these policies?
Thank you, Stuart. Actually, the older persons in Indonesia are actively participating in advocacy to the government for better policies and programs. I myself, I'm an older person, and I'm still very active in advocating, but I cannot do it alone. So we contact all the seniors, we prefer to say senior citizen. We contact all the senior citizens who are willing to join us for better policies and programs on aging issues. And we have done it actually since the MIPA. So we have continued, and we are still continuing. So older persons and the government also invite the senior citizen whenever they are in discussion or planning of national development or new policies and programs. Even now, they are reviewing the legislation on older persons' welfare that was published in 1998, so not relevant with the situation today. And the seniors or the older persons are invited to participate in this discussion. So they do actively participate in all these discussions.
Thank you very much, Eva. Kanamori-san, I mean, your organization is clearly very successful in Japan, engages a lot of people on a very pressing topic. How does your organization interact with the government? Does the government listen to your suggestions in Japan, your recommendations? Can you see your approach to supporting persons with dementia being integrated into government policies somehow?
Our activities are part of the government policy or activities. So through our activities, we can find some findings or notice certain things, and we can pass that feedback on to the government. So we work quite closely with them.
Thank you. And Krishna, in Nepal, how do you, if we assume that this kind of multi-stakeholder approach or inter-agency, intra-agency approach is really the key to this, although I feel like we've said this before once or twice, how is this working in Nepal? What's your thoughts on this in Nepal?
Thank you, Professor. And thank you also, Professor Hamadi, Tanghu Hamid. I'm taking at the both points, and also I will take to the Argentina Matab presentation. What I've experienced in Nepal is UNFPA is very powerful, but because of its, it has been very effective. But one of the, I think, precondition or the, I don't know, format it operates, it works with only population ministry. So because it works, its mandate, maybe it is mandated, I don't know, mandated with population, it doesn't interact with other ministry, like the Ministry of Older Person is different, and Ministry of Agricultural Development is different. So I think UNFPA, I have seen many points where UNFPA has really mobilized government, and it has been very helpful for people like me to take our issue to the UNFPA, because sometimes the government doesn't take our points very easily. It doesn't take with much seriousness. So if UNFPA could give us some hand in working with a different ministry, and working in the same way that you have been working with population ministry, I think we can move around that line. Also, I wish in the coming days, UNFPA will focus on working on Ministry of Older People in our country, and also Ministry of Development and National Planning Commission, so that your multifarious activities will help us to mobilize our government capacity for the benefit of older person. Thank you.
Thank you. Well, Eva Sabdono, while we're here, what do you want from UNFPA?
A lot, actually. I mean, when we talk about aging issues, actually, there is still a lot to be done. We are celebrating the International Day of Older Persons that was designated by the UN General Assembly 30 years ago. Actually, my question is, how far have we come in response to the aging issues? I know a lot has been done, but you know what? If you ask me what I want from UNFPA is to lobby with the UN regarding the Convention on the Rights of Older People. Because without that document, if that document is ratified by all the governments, then the governments are obliged to follow the Convention on the Rights of Older Persons. Nowadays, there is no binding document that inform the government they have to do that. It's a right of the older persons. Now, what I have seen that they can do this, they can do that, but whether it really fulfills the issues that is faced by the elderly is still a big question. So they can do it or they cannot do it. The other thing is that because there is no binding document, each time there is an overturn of the people, of the decision-making people, everything can change again because there is no binding document. So I don't know, we have been advocating for the Convention on the Rights of Older Persons, of course, me as a part of Help Age International, and it's still in, it takes such a long time. Yeah, so if you ask me what I want from UNFPA, please lobby with the UN regarding the Convention on the Rights of Older People. That is the best thing that we hope you can help us with. With we, I mean older person in Asia Pacific. Thank you.
Thank you very much, Eva Sardono. Yes, and so another issue, of course, which is ongoing is precisely this: the notion of the kind of the formulation of this. Just as we're heading into the last few minutes here, maybe I might just ask a question about ageism, because, of course, and I think that's partly related to this issue that. And this is something which is a question which has come up on YouTube actually, is around the perception of aging and older persons as a problem, right? Whether it's population aging in a macro or abstract way, or that older persons are burdensome in some way. And then, of course, the natural reaction to that is to go to the other extreme and to say, oh no, there's no problem at all, right? There's no issue, we should be happy, population aging is the most amazing thing in the world. Do you think it's actually that, I'm sorry to speak like a sociologist, but is part of the problem, Professor Hamid, that we've got the framing of this wrong, that we're not really presenting the true reality of aging, both at the macro level and the micro level, and this is preventing us from actually getting some decent policies out there?
I tend to agree with you, Stuart, because I just talked this morning about positive ageism and also the negative ageism in our National Day of Older Person. Because because I put it in the context of COVID, because we were talking about the international team for the older person in terms of COVID. So for Malaysia, what happened was, because they quote unquote being protective of older person, so they said that age 60 you can't go to the mall, you can't go to this, you can't go there, because their thinking was to protect the older person. But to me, it is a positive ageism kind of thing, because we tend to think of older person as one group, because there are older person who are not healthy and they should be prevented from going outside, but there are older person who are healthy that with the behavior now that we are encouraging with wearing the mask and things like that, they can be going out into society. But and to me, because of that, we quote unquote being overprotective of the older person, we sort of don't allow them to be in the open during the COVID time. But it's also the older person themselves are not portraying that they are that. They are to be respected and things like that. Because from my own data of looking at two dimensions of income and functionality, in Malaysia, the older person is less than 5% of the older person actually need welfare, and 60% of the older person are healthy and they have income. So this different perspective, because we have 4 typologies, but I'm talking just the 2 extreme, meaning that the government is spending a lot more attention to the 5% of the older person, while neglecting sort of into looking at how we should mobilize the older person that is healthy and can contribute to society. And because of our mentality of having policies that fits all, We can't do that anymore. And also in Malaysia, there are certain states and certain what we need to do, we need to reorientate the governments and also the civil society in that area to look at aging as an opportunity and how we can harness them into that. Because and also some of that is cultural, because like for Malaysia, when an older person works, and the children felt that it's a reflection of them not caring for the older person. I think, and I think that's not the right way of thinking of the older person being active in society and things like that. So I think there needs to be an overall transformation in terms of thinking about aging itself by the older person themselves, by the by the structure in the government, and also by the older person organizing themselves, because we do not have a strong representation of older person groups in the society that calls for that makes the government pays attention to their needs. Because we were able at the institute, we were able to create a platform for aged care providers, and now they're getting government attention because of the issues that they are faced with in residential care facilities for the aging. So this is where I think we need to have an umbrella body for older person organization to create a strong voice on behalf of the older person, and to be listened to in policy design and implementation. Thank you.
Thank you so much, Professor Hamida. I think that that's really a great kind of thing to end our discussion as a kind of the takeaway. And just to really go back to what we discussed earlier, that we always thought, we, working across agencies, working between districts and federal organizations, it can't be done, it's too complicated. But with COVID, in some places than others, it shows that it can be done if the push is big enough, right? And if the will is big enough. So maybe there is some remote positive aspect that we can take out of these experiences of the last year. Well, I'm getting very stern messages from UNFPA to tell me to wrap this up now. So I will just very quickly say thank you so much to our panelists, Krishna Gautam, Aging Nepal, Professor Dr. Tunggu Aidsan Hamid in University Putra, Malaysia. Thank you so much, Professor. Ryasuku Kanamori, the very best of luck with your organization in Japan, and of course Argentina, Mataval from UNFPA, for all of your work and for your contribution so far. So I will just quickly pass over to Eva Sabdono for just maybe 2 minutes or 2 or 3 minutes of closing remarks.
Oh, Stuart, just hold on.
Oh, gosh, sorry.
Before we asked the Mrs. Eva Sabdono to actually provide the closing remarks, might be actually a good idea to have some sort of observation or comment from our regional director, Bjorn, to probably particularly his observations, I guess. Can I ask, Bjorn?
Yes, thank you, Rintaro. And of course, this has been, as I expected, a fantastic discussion. And thank you, Stuart, for leading us through it. I really appreciate all the comments and observations made, and I think there is so much we need to address as we're moving forward. And what really made an impact is it's the comments on how we, as part of the UN system, can move the agenda of population aging forward in different contexts. And we need also to understand that that this is something it's not new. I agree with that, but it's also new in a new context. It's an issue in a new context, maybe that's how to put it. We have a world which is much more exposed for humanitarian crisis. We have the sustainable development goals. We are seeing rapid economic growth. At the same time, we are now experience COVID, etc., etc. And we need to understand how older persons, what the needs are, and how they can also, of course, continue to contribute in very uncertain environments. So I really think there is so much we need to continue discussing. And I would like to thank all the participants for putting that on the table, and also challenge us as UNFPA. Very much appreciated. So thank you, and over to you, Rintaro.
Thank you, Bjorn. So thank you very much. So I think before I'm going to ask the Mrs. Eva Sabdono to sort of give a closing remarks, yes, I'd like to say that really thank you very much for all of your actually conversations. I think I'm even much more actually motivated to push this work, and I got a lot of homeworks around. And I think it's just last word. Before I actually ask Mrs. Eva to talk. I mean, we actually talked about the older person's involvement in the policy development and the policy making. But I think it's one thing that we need to actually think about in the Asian Pacific region is that so many governments are dominated by the old men, actually. So not necessarily, and actually they are from the very sort of the similar characteristic group. So when we actually talking about the participation of the older persons, actually we need to think about diverse actual older persons, including actually gender balance. That's something I think we need really to actually think about again. Anyway, that's my personal observation. So shall I ask the Mrs. Eva Sabdono to actually provide her observations and the closing remarks? Over to you, Eva. Thank you.
Okay, thank you. Well, some information that I wanted to express was already said during the discussion. But from the discussion, we learned that actually the challenges faced by the elderly, whether it's in Asia Pacific or in Asia, doesn't differ very much. There is this ageism, and how to handle it or to combat it. I do believe that mainstreaming aging in society to achieve the goals of a society of all ages and to encourage the basic concept of aging should begin early in an individual's education, both formal and non-formal, based on the life cycle approach. Older persons of today, especially in Indonesia, they didn't have the formal education, but we have to think about the future. Older person of the future, they have a good education. It's different from the past years. So the education is number one. The other challenges are like Kanamori-san said, not enough specialist geriatrician, and we have the same problem here in Indonesia, because in the past aging was not on the development agenda. Even in Indonesia now, people with dementia have already reached more than 1 million, and we just don't have enough geriatricians. So education of specialists in geriatric is also another issue that, of course, we hope it's through, besides UNFPA, the WHO. Without education, then health services for the elderly will always not enough, especially like Indonesia consists of 17,000 islands. How to distribute the specialists in all these 17,000 islands? So education is number one. Training for specialists on geriatric is another one. Ageism can only be combated with mainstreaming aging in society. And another one is that we have all experienced the devastating impacts of the pandemic over the past month, but the pandemic has also presented us an opportunity to rethink the future. And when we think about older person, it should be that there is a decrease in functionality. That's all, nothing else. It is a normal process that the functionalities of older person decreases while the age increases, and the number of older person also increases. So it has to be bear in mind that when we have to rethink aging. So we have only to understand that aging is a decrease in functionality of the older persons, so that they will have limited abilities that should be responded. Yeah. And actually, the hope is, of course, for UNFPA, because you asked it before, is that the well-being of older people is clearly defined as part of the human rights and social security framework. We look forward to having practical ways to effectively implement protocols on the ground, especially during and after this pandemic, in the world in general, but especially, of course, in Asia Pacific. And it is events like this, face-to-face or whether virtual meeting, is very important. We have learned this through this pandemic. We can discuss with each other, but we don't have to be in the same room. So we hope that there will be more events like this, that we, young and old, learn from each other. We share the experience of those who have lived long and the enthusiasm of those who still have long to live. So some of us are old now, including me. But hopefully everyone here will have a good old age in the future. Thank you.
Thank you, Mrs. Eva. And thank you very much for everyone. And also thank you very much for you as the audience and the active participation in the comment. That was actually the first of the series of the event. So that's encouragement from Mrs. Eva. Actually, it's going to be true that we actually hoping to have the series of the events. One of them might be actually talking about the COVID-19, other aspects of population aging. So we'll come back to you. And thank you very much for all. Bye-bye.
I must say thank you, Eva. I support you. Thank you very much.